Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. We'll start today's show out with an update from Dr. Rosanna Salvatera, Peterborough's Chief Medical Officer of Health, as she outlines some new symptoms you should be on the lookout for before getting tested for COVID-19. Here's her address from earlier today.
Let me begin, and I'm going to use our dashboard to share with you our local data, and this dashboard is updated every Wednesday at noon for us so that you can have access to it with me. So you'll see that we have had a big jump in the number of cases. We are now reporting 86 confirmed cases for Peterborough. That is an increase of 27 cases in the past week. And I think in order to understand why that's the case, I think we need to look at the total numbers of tests having been done in Peterborough. So you'll see that we are now at 3,713 tests. That's an increase of almost 2,000 tests in the last week alone. So last week we were just over 2,000, we've had 1,700. So the amount of testing that's been done in the past week is equivalent to how much had been done in all the weeks leading up to it. So I think this is really the main reason why we're seeing the increased cases. So I think the efforts of our partners, the Peterborough Regional Health Centres Assessment Centre and the Peterborough Community Paramedics to implementing the provincial guidelines to increase testing are really paying off for us. As we learn more about COVID, there is a growing recognition that people can have other symptoms besides a fever and a cough or shortness of breath. So the screening questions for COVID have now been changed. And in addition to fever, cough, and shortness of breath, people are being asked if they have two or more of the following symptoms: a sore throat, a runny nose, sneezing, nasal congestion, a hoarse voice, difficulty swallowing, loss of their sense of smell, chills, headaches, unexplained fatigue or malaise, diarrhea, abdominal pain, or nausea and vomiting. In addition, if someone is over the age of 65, they are asked if they are experiencing one of the following: a new delirium, falls, acute functional decline, or worsening of their chronic conditions. So many of our new cases were in fact found because of this these increased criteria. Of the 10 cases, for example, that were reported to us on Sunday, 2 of them did not have any respiratory symptoms at all. They were gastrointestinal. 2 only had a runny nose and a sore throat, which would not have been accepted for testing earlier. And 6 had very mild symptoms of cough, mostly without fever, and 1 person said their symptoms only lasted for 24 hours. So of these new community cases, indeed, they are all mild, and this is reflected also in our stats, our data that reflects that only 7% of Peterborough cases are hospitalized in comparison to the provincial average of 11.4%. I think the other reason why, if I can stay back on that last slide, please, Brittany. Another reason why we are at 86 this week is because of the provincial mandate to test all staff and residents in any facility with a COVID outbreak. So because of that, we picked up an additional 9 people in one of our homes where an outbreak was occurring. Most of them were asymptomatic at the time. We've been working with that facility to ensure that all positive residents are isolated, even though they are not currently ill. And this week, teams of nurses, physicians, and paramedics have gone into 3 new long-term care settings which each had a single case of COVID to test all staff and residents. Because these settings are high risk for the vulnerable seniors who live there, we are testing people even without symptoms. But this is not the case for community members unrelated to these outbreaks or outside of a long-term care setting. So our numbers do include the additional asymptomatic cases that have been found from the enhanced surveillance now being done in long-term care. Over the next 2 weeks, all long-term care homes and retirement homes in Peterborough will be screened as a joint initiative between Peterborough Public Health, PRHC's Assessment Centre, and the community paramedics. We expect to have that completed by May 12th. We have some encouraging results from 2 that we've already done. That's Centennial Place in Millbrook and Applewood Retirement Residence in the city, where we found no evidence of COVID-19. So if you look at the positivity rate for our testing, it's 2.3%. That's actually fallen from 3% last week. Again, just indicating that the increased numbers we are seeing are reflecting increased testing rather than an increased prevalence of the disease. So let's look again a little more closely. We'll see now that we have 42 cases resolved and we have 2 deaths, including 1 in a long-term care home where COVID was listed as a contributing factor. We are still testing more women than men, 59% women, 41% men, and this might reflect the fact that most healthcare workers in long-term care settings are women. It certainly is being seen consistently across the province, and here this slide reminds us as well that most of our cases are between the ages of 20 and 79 years of age. Next slide, please. First I want to begin with the source of COVID-19 exposure on the right-hand side there. You'll see that being a contact of a case is now the leading risk factor for contracting COVID. And that's an important reminder for the importance of self-isolation for anyone who is ill, and why physical distancing is important even when people are not feeling ill yet, before they have any symptoms. We continue to do very active follow-up of all of our contacts of cases. You'll see that travel now accounts for 27% of our cases, and we can see that community transmission is a growing factor, with 23%, or almost a quarter of our cases, now having no link to travel or to a known case. We've listed the outbreaks for you. There are currently 5 outbreaks in Peterborough. All are well controlled. St. John's Senior Centre is not a long-term care home, but we did have a case there, and on the weekend the paramedics were in, and we had almost 50 people tested in that setting.
Dr. Salvatera brought us the numbers for Peterborough City and County. Now we'll take a look at the statistics for COVID-19 from Kawartha Lakes and Northumberland. Starting off in the city of Kawartha Lakes, 138 confirmed cases, 8 hospitalizations. 95 of those 138 confirmed cases have been resolved. 32 confirmed deaths as part of 3 outbreaks. And in Northumberland, 13 cases, 1 hospitalization. All 13 of those cases have been resolved. Peterborough's West End continues to have issues with physical distancing due to the Sports and Wellness Centre being used as a homeless shelter during COVID-19. Mayor Diane Therrien says the facility is being cleaned regularly and screening for both staff and residents is taking place.
I know that they've been working with public health and the other, agencies to figure out best practices for how to keep the screening process up and have it be quite rigorous. Make sure that if there is anybody that is that either tests positive, needs to isolate, they have plans in place for that. And they've been working really closely with a lot of other community partners to make sure that there's that adequate space and that they are practicing inside the wellness center. It's cleaned every day. The bathrooms are cleaned like 3 times a day for an hour each. So they are doing a lot to try to make sure that once you're in, and but that's the thing too, like the tests aren't immediate. They're faster than they were, but it is still it's not a perfect system by any means, but again, it's being adapted and it's evolving pretty much each day to figure out how to make it better, safer, cleaner, healthier for everybody, while also trying to enforce. And we have, had some concerns from folks in that area about people that aren't, physically distancing. And if you're in the wellness center, you're still in a confined space. And then if you go outside, it's, there's people have just a natural, you're just naturally inclined to sort of sit down together on the grass if it's a nice day. And so I know that they've been trying to work with the staff and volunteers there to go out and be letting people know that they aren't to be doing that, even if they think everybody that they're sitting with has tested negative. That's, and that's something that we're going to see too in the community writ large as we move into the weekend where there's, nicer weather coming up.
The mayor sits down for a full half hour with Your TV's host Paul Rellinger on Peterborough Matters tonight at 7 p.m. Yesterday, we introduced you to Melanie Payton, a teacher who recently returned to Peterborough. Even in quarantine, Melanie explains the strong sense of community and togetherness she immediately feels here. She also explains how difficult it is to be separated from her mom, who's in a long-term care facility.
It feels strange because I haven't even been out here. So all I've seen is from the door. I'm technically not even supposed to go for a walk, and so of course I'm not. But it's just funny because I just see, people going for a jog and walking their dogs and, out. And my dad's come to visit me a couple times. They're just standing way down on the lawn, which is nice. And my brother, it's like nice to see a real face, but it's, I don't know, it's still the relief that I feel being home is it's amazing. Yeah. Being able to get information constantly and know where to go and know what to do if something happens, that makes a huge deal. I've lived in Monterey for 8 years, and I'm certainly very comfortable there, and I felt very safe in my community, and I did feel like our community was doing a good job, but it's still not the same as being home. Before I came was that there was a real sense of community building here, which I think Peterborough always has, but especially in times of need, that's really nice to see. And that was something that, if it was there, in the community where I live is quite a wealthy community, and people live behind 30-foot walls. So when you walk down the street, you don't even see people's front door or house. So maybe there was something like that happening, but as an expat, you felt as if there was none of that, and that made it extra hard. Because I could see I have friends all over the world that I've been talking to in Italy and China, and they all were kind of talking about this feeling of community, even though everybody was inside. But I was not feeling that. And part of that might have been the fact that, you're just a bit isolated as an expat and the language and everything. But I also feel it was something that made it, harder being there. So seeing that sense of community here is really nice.
So it's really hard. How are you managing this, mentally?
Well, I know, not that well. It's very scary to think that somebody could get sick or die, and you won't be able to be together, right? And believe me, that was a huge worry for me too in Mexico. And the thing is, I live abroad. I've lived abroad for 20 years, and I know that, something could happen to me and I might be away from home and alone, but I'm with my friends, I have a lot of friends there. And when you live abroad, your friends become very close, so they're very helpful. But yeah, during this time, knowing that if that happens, that was honestly, that was what made me want to come home. My mother's in a nursing home here too. So God, whatever I call them, I don't know how they hold it together. It's amazing. They always sound so together and positive. And, they're taking great care of my mom. I try to arrange video chats, which was amazing because I hadn't been able to see her. But it's, I feel like a lot of people, are kind of relaxed. It's different when you're just at home and you got all your family with you. But when you're far away, it's very, very different feeling.
Yeah.
That was honestly, that was what made me want to come home. And for sure, thinking about mom, I try not to worry. It was very stressful before. I feel a huge weight lifted since I came home. Even though I can't, go in there, believe me, the minute I'm out of quarantine, I'll be driving out there and standing outside the window, I said, you can see me out the window. And it's not, I know that they're trying to get more laptops and things, there as well, because they're the nurses and the care workers are trying to help, facilitate video chats with the people there. And that is like, it's so valuable. The other day I got a surprise call from them and was able to do that with Mom. It was amazing, and to be able to do that after months of like not seeing her, because normally I do video chats with my brother and stuff, and we try to do it when he's with her, but we haven't been able to do that for a while, and it just made her so happy,
Mm-hmm.
and me too. So
Community Care Peterborough has been revamping its services to seniors since the pandemic started. They offer social and exercise groups, fall prevention clinics, and more. Your TV's Mary Tendeshat speaks with Darcy Maude of Community Care Peterborough, who says their volunteers are calling seniors regularly to help them cope with the pandemic without talking about the pandemic.
And the purpose of the call is to talk about other things, to get your mind off of what's going on, to share stories, to have a laugh. That kind of thing is so important right now. And it's something that clients can look forward to. They know that weekly or twice a week, they're going to be having someone call in and have a conversation that is enjoyable and have a little bit of a break from what's going on. And in the city, we've done over 100 phone visits with clients in the last month.
You mentioned that some of your regular groups are either slowing down and then some are actually more popular than ever.
Yeah, so any of our programs that were coming together to meet are now on hold. So a lot of our offices throughout the county had coffee clubs weekly or drop-in art groups or craft clubs. We have very busy exercise and falls prevention classes, which are now on hold as well. We have an active diners clubs in most of our county offices where people come together monthly for a meal together.
And what are the programs that are actually picking up now during the pandemic?
So our telephone friendly visiting is one that's really growing. We also do telephone reassurance calls, which are a daily check-in to clients, just to make sure that they're doing okay. So the calls aren't as lengthy as they would be for that telephone friendly visiting, but it is a daily check-in to make sure everyone's okay. We are also seeing some increases in our Meals on Wheels deliveries, especially our frozen meals. We're seeing a lot of people ordering those frozen meals to have on hand.
And Meals on Wheels, obviously a very important program. Have there been any changes on how that's being delivered to the senior?
Most of our clients leave a little table outside of their door. The volunteer is able to put the meal on the table, knock, step back away from the door so that they can still see each other, but aren't interacting face to face there. So while we've been calling clients to check in and to see how everyone's doing, one thing that we were finding that was constantly coming up was some concern about grocery shopping and making sure that clients were able to get essential items into their home. So we have recently just started a new grocery delivery program and some grocery shopping for some of our clients. It is a program that's intended for clients who really don't have any other people or family in town that are able to help them with this. So our website currently does have a list of all of our services that we're continuing to offer at this time, so people can check out our website, or you could call our office and leave a message and we will return your call and we can talk about the different programs and services that we're able to offer right now.
Community Care Peterborough requires delivery drivers to wear masks and gloves for their Meals on Wheels program. If you are able to help out, please contact Community Care Peterborough. Coming up on Your TV, we'll take a look at what's going on in Northumberland. Welcome back to COVID-19 Local Impact on Your TV. I'm Dan Malta. The Art Gallery of Northumberland Spotlight Series is going virtual. This Thursday night at 7 p.m., the series will feature the owners of the Cardboard Reality Farm and Studio. Your TV's Mark Rockburn speaks with the series producer, Elizabeth Palermo, to find out more about the event.
The Spotlight Series is about bringing our emergent and established artists from across the county into the gallery for an intimate and interactive performance space. We really want to get behind the artist's story and process and understand their journey in a smaller venue where we can intermingle and have some questions on the fly.
Who have you brought in the past, I guess?
We opened our first season 2 Septembers ago. We opened with Saskia Tompkins and her duo Two-ish. We've had a panel of 4 local authors discussing the common themes in their books and memoirs. We've had David Newland, and this past season we were featuring Stuart Ross, a local poet. He has his roots based in Toronto, but he's lived in Coburg for the last several years. We were pleased to bring in also Shannon Linton, who's got such a variety in her musical background. So she carried us from a time and place where she was an opera singer all the way through her journey to being a pop singer here, folk singer, whose heart lies in living and singing and performing for her small town kind of audiences. Then we had the Northumberland Contemporary Dance Collective, which was really something new in the gallery to have 4 dancers on our small stage space. There were a lot of moving parts. It went over beautifully, and it was really something to see. And of course, then we wrap up this current season with Cardboard Reality Farm and Studio.
So let's talk about this Thursday's presentation and the fact that with the current world, the way the world sits, a lot of things are going virtual. So why did you guys decide to go virtual rather than maybe canceling the event altogether, seeing it usually brings new people into the art gallery?
Well, we still wanted a way to highlight their story. Becky and Keith have put a lot of heart and soul into their project. I have just personally been so thrilled to learn about them through their street front storefront on King Street in Coburg. So they have a lot of diverse, dynamic, beautiful artistic offerings. And we very quickly connected with them and said, look, of course, given the current situation, we'll have to cancel the in-person gathering, but how do you feel about going virtual? And they were thrilled and ready to take the lead on that right away.
So what are people going to learn about this Thursday?
Well, I think, foremost, we're just thrilled to still connect with our audiences. It might even be a broader reach because, of course, the internet. And so those who may not be able to come personally to Coburg, to the art gallery in Coburg, will be tuning in online. So it'll be interesting to see and get a sense of who's able to join us. They're going to hear from Becky and Keith their own journey and story. They're going to be coming up with their own musical interludes, sharing some musings. They'll be screening a few short films of theirs. We'll get a sneak peek at Becky's latest short animated film, which was her thesis for her MA. And there'll be an opportunity for question and answer.
So how can people get involved?
Well, you got to log on to Facebook. If you don't have an account, then try to find your way there and look for the Art Gallery of Northumberland's page. We'll be live at 7 o'clock Thursday, April 30th.
Sounds like an exciting event. Queen's Park Report is a regular half-hour program on Your TV. Host Mark Rockburn speaks with Northumberland Peterborough South MPP David Piccini on issues that affect the residents in his riding. The show has taken a hiatus due to COVID-19, but today the show was recorded via Zoom. The issue of when the legislature will resume sitting was one of the topics of discussion during the taping.
Our clerk and everybody within the legislature, our staff, are looking at alternative ways to meet and conduct legislative business via Zoom and or other online measures. That would predominantly at this juncture revolve around committee work and certainly looking at some private members' bills and continuing committee. The sitting, our next session is scheduled for May 12th, at which point I would imagine we would start looking at what perhaps a reduced member sittings would look like going forward, and or examine where we're at relative to the modeling and relative to the number of cases of COVID we're continuing to have on a daily basis within the province.
I know that you did sit a couple of weeks ago, David, just to get some bills passed or some legislature passed to be able to get some financing out. Was that on a limited basis of numbers or that way?
Yes, it was. It was a limited basis. The House leaders all meet and agree to come together to determine the number of members that can sit. And so we met to extend the emergency order to provide much needed relief for students. Obviously, the piece that I was there for to speak to was our support for students via OSAP. by removing the accrual of interest and ensuring students didn't have to worry about payments for 6 months. In addition, we passed emergency measures for $25 million into our institutions, the bulk of which has gone to emergency funds for students in most in need, and some that are still on campus. And finally, also online proctoring of exams so that we can have continuity of education and students can complete their year.
Going forward, David, can you see the new norm, or what we are calling the new norm, a scaled back version where maybe some members will be in the house and some will join by Zoom, or are we still looking at different ways we can do this?
I would certainly hope so. I mean, we launched yesterday the framework for reopening the province, which is a 3-stage plan to lay out our approach for the next chapter in the ongoing fight to defeat COVID-19. And I think outlining those key principles that the government will use to reopen business, services, public spaces in gradual stages is key. As for how the legislature will look, I think at this juncture, it's a little too early for me to comment on exactly how it would look. I'm hopeful that we can get back. I mean, we would like to continue to debate and continue to discuss and pass important legislation. However, obviously, it's leaning on Ontario's Chief Medical Officer of Health and that advice. But the important thing, I mean, announcement yesterday on the framework for economic recovery. Well, it's been exciting because I've already started discussions with our local chambers, with local businesses, with our county, into Clarington and Peterborough on what a regional economic recovery task force would look like. So we're in the early stages of that. That will feed into the budget.
For the full interview, Queen's Park Report will premiere tomorrow night at 7 p.m. right here on Your TV. That's the show for the evening. We'll see you tomorrow. For Your TV, I'm Dan Malta.